When it comes to your teeth, you're basically standing at a crossroads every single day. One path is all about proactive prevention. The other, it's reactive repair. We're going to break down what each of those paths really costs. And I'm not just talking about money. So let's get into it.
Okay, to kick things off, I want you to really think about this for a second. What is the single most expensive, costly procedure in all of dentistry? You might be thinking it's a full set of implants, maybe a super complex bridge, or some kind of Hollywood cosmetic makeover. But I bet the answer is not what you think.
Believe it or not, the answer is doing nothing. That's right. The most expensive thing you can do is neglect the small problems, letting them sit there and fester until they explode into these big, painful, and wildly expensive emergencies. When it comes to your teeth, inaction is always the priciest choice.
So to really see how this plays out, we're going to follow a tale of two teeth. Let's imagine they both start out exactly the same, perfectly healthy. But they're about to go on two completely different journeys. And this, right here, is the core of the choice we all have to make.
And really, this is the choice right here. On one side, you've got the path of prevention. The focus is simple: keep your natural tooth healthy for your entire life. The costs are low. On the other side, you have the path of repair. Here, the costs are high, they keep coming back, and the inevitable outcome is losing more and more of your natural tooth with every single procedure.
All right, let's take a little walk down that path of repair, shall we? It's a total slippery slope. Once you're on it, one small, untreated problem just naturally leads to a bigger one, which leads to an even more complex and expensive one. It's this cascade effect that's both predictable and, thankfully, preventable.
And this downward spiral, man, it's almost scarily predictable. It usually starts with just a small cavity. If your habits don't change, that first filling eventually fails, so it gets replaced by a bigger one. Pretty soon, so much of the tooth is gone that it's weak and it needs a crown. Then maybe the nerve inside gets infected and boom, you need a root canal. And finally, the tooth is just too brittle to save and the only option left is to pull it. Each step just leads right to the next.
And this brings us to an absolutely critical hard truth in dentistry. It's a simple fact. Every single time a dentist has to go in and fix something, you are left with less of your own natural tooth than when you started. It is always a net loss. There's just no way around it.
Okay, so when prevention has failed and you're stuck on that repair path, what's actually in the dentist's reactive toolkit? What are they working with? Let's take a look at the common procedures they use to manage the damage once it's already done. Think about it like this. To put on a standard crown, a dentist has to grind away about a third of your healthy tooth structure just to make room for the cap. I mean, that's so invasive that in up to a third of cases, the nerve inside the tooth actually gets damaged, which, you guessed it, creates a whole new problem.
And when things go from bad to worse, you hit the bottom of that spiral. We're talking root canals to clean out a dead, infected nerve, and extraction to just remove what's left. And then you get into the really complex, really expensive replacements like bridges, dentures, or even surgical implants. This is the end of the line for the repair path.
All right, enough of the scary stuff. Let's completely change gears and talk about the much better, cheaper, and healthier alternative, the proactive prevention playbook. This is where you get to take back control of your dental story.
And you know what? It all boils down to something incredibly simple. The most powerful weapon in your arsenal isn't some high-tech gadget, it's your toothbrush. Its main job, its only job really, is to physically scrub off plaque, that sticky bacterial gunk that causes all the trouble. That's the whole game right there.
Because if you don't get that plaque off, it leads to this nasty thing called periodontitis. And this isn't just gums that bleed a little. No, this is a serious infection that literally eats away the bone that holds your teeth in your jaw. Let it go long enough, and your teeth will get loose and can actually fall out.
Now, for roughly 10% of people, this gum disease can get aggressive enough to cause them to lose teeth early in life. And that's why going to see a hygienist is so important. They can get into all the nooks and crannies your brush can't and stop this disease dead in its tracks.
Okay, listen up, because this is probably one of the most important points. The problem does not stay in your mouth. The bacteria from infected gums can get into your bloodstream and travel all over your body. We now have proven links between gum disease and major health issues like heart disease, kidney disease, even Alzheimer's. Your oral health truly is your general health. Here's another super smart, proactive tool, especially for kids and teenagers: fissure sealants. It's just a thin plastic coating that a dentist paints onto the chewing surfaces of your back teeth. It literally seals up those deep grooves where all that nasty plaque loves to camp out, blocking decay before it has a chance to start. It's simple, it's painless, it's brilliant.
But hey, prevention today isn't just about brushing and flossing. Modern technology is giving us some seriously powerful new tools to make staying healthy way easier and more precise than ever. I mean, what if we could make all this prevention stuff easier, more precise? What if you never had to deal with one of those gross, goopy dental molds ever again? Well, guess what? That future is already here. Well, say hello to the STL file. Instead of using that tray of putty, a dentist can now use a tiny camera, an in-mouth scanner, to create a perfect 3D digital model of your teeth in just a couple of minutes. It's quick, it's way more comfortable, and it's ridiculously accurate.
So what can you do with this one digital file? Oh, the possibilities are awesome. Say you lose your retainer at college. Your dentist can just pull up the file, 3D print a new one, and mail it to you. Easy. Need custom whitening trays, a night guard to stop you from grinding, a sports mouth guard? It can all be made perfectly from that one scan. This is technology actually empowering prevention. So, at the end of the day, it really all boils down to one simple choice. The knowledge is out there, the technology is here, the power to pick the right path for your health is totally in your hands.
I mean, look at this. When you put the two paths right next to each other, the difference is it's night and day. Prevention means you take action. The costs are low, and the outcome is health and confidence. You feel empowered. The path of repair means waiting, dealing with high and escalating costs, pain, tooth loss, and a whole lot of anxiety. The choice is pretty clear, isn't it?
Which brings us to the single biggest takeaway from all of this. Real success in dentistry isn't a flawless crown or a perfectly matched filling. True success is having teeth that are so healthy they never need any of that stuff in the first place. The absolute best dentistry is no dentistry. So, think of your dental future as a story, and you're the author. It can be a really short, happy story about prevention and good health, or it can be a long, drawn-out, expensive epic about repairs and replacements. The question is, which one are you going to write?